Former Pro Mastery Hub, we'll be looking at otitis media. Otitis media, when you break it down, ot mean ear, itis inflammation, media middle. So otitis media is the inflammation and accumulation of fluid in the middle ear. What are the causative agents or pathogens that can lead to otitis media? We have streptomyces pneumonia, we have Haemophilus influenza, Moraxella catarrhalis, and some viruses like viruses from this class, rhinoviruses and adenovirus. What are the symptoms to look out for when a child is experiencing otitis media? The child might have fever, there will be difficulty sleeping, the child will experience ear pain, and because the child cannot speak, might not be able to tell. Some children cannot be able to tell you this is what their problem is. You see them putting their hand on the affected ear. You see the child crying more. Some children will experience loss of appetite, headache, diarrhea, and then you observe the bulging of the tympanic membrane. You see the eardrum bulging coming out. Now, what are the complications that uh, one should look out for when this otitis media is not treated? You look out for impaired hearing. The person might not be able to hear well. There will be spread of infection to the other parts because the microorganism causing it are multiplying and then spreading. There will be developmental delay. Then the tympanic membrane, there will be tympanic membrane perforation, tearing of the eardrum. You experience tearing of the eardrum. Then meningitis, the child might have meningitis. So, what are the diagnoses? The signs and symptoms observed from the child will be able to tell the doctor, okay, this is what is wrong with the child. The another thing is physical examination. The doctor will be able to check the ear and ascertain what the problem is and what kind of infection it is. The treatment option, the doctors usually do the wait and see approach to see if the otitis media can resolve on its own. And if it doesn't resolve on its own, this is usually done under strict monitoring. And if it doesn't resolve on its own, what happens is they look at antibiotics therapy. And in this antibiotics therapy, the first line antibiotics, the first drug of choice is amoxicillin. For children that are allergic to penicillin, you can give clindamycin or azithromycin, or you give second or third generation cephalosporin. Then for the second line treatment, you give amoxicillin clavulanate. Now, some children, because of the pain the children and fever the children are experiencing, you can give NSAID like ibuprofen or Panadol to ease the pain. Thank you.